So back to my regular programming. So today I had two great cases in the operating room. I had two breast reductions, but they were both a little different than my usual. So my first reduction was a patient who already had a reduction about 20 years ago, and her breasts have grown again, and so I repeated her breast reduction. Now, if you repeat a reduction more than 5 years out, you really can do it any way you like, with one exception. You need to use the incisions for the most part that the patient already has. So I typically do reductions with a lollipop or vertical incision, but this patient already had an anchor. And so if they already have the anchor, then you really need to stick with an anchor to get the shape right. So that was my first case. And then my second case was a breast reduction by liposuction. And this is really one of my favorite procedures because it's minimally invasive, it gets the job done for the right patient. It's great. So you're really limited with how much you can reduce the breast with liposuction alone, but it works really well to get about a cup size reduction, and you do get some skin tightening with it. So if you just want a small reduction, you don't need a lot of lift, a liposuction breast reduction is awesome because there's just two tiny incisions, the healing is really fast, and you're back at it much quicker than a traditional reduction. So fun day. It's nice to have two cases that are a little different than my normal.